Hold on. Hi, everyone. We have the pleasure of having Dr. Mamatha Sirivol. I hope I'm saying that right. One of the co-authors in this amazing book, How Healers Heal. And she's going to share with us some wonderful tips about lifestyle medicine. So Mamatha, please, Dr. Mamatha, please, Mamatha, I'm saying your name wrong. Please introduce yourself.
Hi, everyone. My name is Mamatha Sirivol. I live in Maine. I'm a family physician and I trained in obesity medicine and lifestyle medicine. I can't put a finger on how I got to knowing more about lifestyle medicine, but just when I was looking for something more to do and when I felt life was stagnant, I stumbled upon lifestyle medicine, and I feel every day that was the best thing to happen to me personally and professionally. And
Was it during COVID?
yes, it was a little before COVID that I was looking into fitness, but COVID really hit the nail home, where I made amazing lifestyle changes and have been practicing since.
It's almost like COVID's been a blessing for us to just further our education beyond medical school into this wonderful field. So how do you incorporate it into your practice these days?
Oh my goodness, I do it with every patient every time. Within the limited time and resources we have, I make sure to talk about at least few of the pillars of lifestyle medicine. And I've been greatly de-prescribing, which has been a great pleasure. I counsel about obesity and lifestyle hand in hand. I print out some pretty good plant-based whole food menus for patients, and we talk about having the smart watches. And in Maine we only have so much sun, and the summers are beautiful, so we try to figure out a plan as to how to make exercise happen in winter also.
I loved that term in your chapter, de-prescribing, because we don't hear that, but I hope we're going to hear that much, much more, de-prescribing in healthcare. What is your favorite pillar of lifestyle medicine?
For me personally, it has been the stress management. And I feel like, all the pillars kind of are so much linked with each other. You work on one thing and it affects everything else. It has like a ripple effect. And I have been working on stress management with doing some meditation, yoga, exercise. Changing my diet has greatly helped me feel better about myself. So I feel that that's my thing.
This book is so wonderful because we get the sneak peek into physicians' lives and just like how you've changed and how lifestyle medicine has impacted all of us. It's wonderful. Why should other people read this book? Why should a physician read this book?
Oh, I personally, having gone through this journey, I feel like I cannot wait to share my experience with everyone. And even if I could, the book could influence few other physicians who could then practice and preach all the patients. I think it helps to educate the whole community and making changes themselves. We are looking at vitality, health, and happiness, and lifestyle medicine is key to that.
Why should a patient read this book?
To see what struggle their doctors have gone through, because I guess no one is beyond the struggles and the journeys, and they could really relate. I tell all my patients, whenever I see a patient with back pain, I tell them my journey, and I feel blessed to be able to do this with them. And I tell them, how I started this, how I struggled, and how I changed. And they're like, could you send me some videos of yoga that you have done, or could you send me the menus that you do? And I'm all excited about it.
I can sense your passion. It's so wonderful, and you're changing lives every day, I know. What is your number one takeaway for a patient who might be looking to make a change, a lifestyle change?
I would say it's never too late. It's never too late to start off on a good path. And just as there is a vicious cycle, there's a good cycle. You do start with one good thing, and then the good events continue. So I tell them it's never too late. Just take it one day at a time and start over, and you will love having made the good change.
I love that. Start small. And then what is the number one takeaway for a healthcare provider, professional physician who might be looking to get into lifestyle medicine? Like, what would you tell them if they're thinking about it?
I would say knowledge in lifestyle medicine will really help with your professional development too, and live about the personal benefits. But I feel it leads to greater patient satisfaction. Your scores will go up if that's all you're looking at, and I feel like you will really feel that you're making a difference.
Those are all such great points. So I don't want to take too much of your time, but is there anything else that you want to share about your experience in lifestyle medicine or your experience being a part of this book?
It's been a pleasure, Shilpi. First of all, thank you for all that you've done since that first message where you asked if anyone would be interested, because this is a great platform for us to be able to contribute our little bit. So I feel so thankful and grateful for you and all the other physicians that are working on this book. I really hope more and more people read this and gain the benefits of everything that's talked about.
Yes, to provide hope is so wonderful to everyone and change. Well, thank you so much. I appreciate you being in this book. Everyone go out and get your copy of How Healers Heal. Thank you.
Thank you, Shilpi. Nice talking to you.